I'm a medical doctor. I work in one of the local universities, so I'm also a lecturer. I'm a pediatrician. So I work with children. Basically, I also work with children who have blood diseases and who also have cancer. I've been a specialist since, a pediatrician since 1998. It was an incidental finding. Basically, that was back in December 2014. I felt a lump over my left breast. I immediately got help from a friend, a close friend. Right? She in fact helped me arrange a lot of the appointments, and I had a biopsy done very quickly, and within 1 or 2 weeks, 1 week itself I believe, I was already confirmed to have breast cancer. So it was just an incidental finding of a breast lump on the left breast. The thing with breast surgery, it is cancer involving an organ, so that has got to be removed. I had my surgery done in the UKM Medical Centre, right? And I had a total mastectomy of the left breast. But after a lot of discussion with some colleagues, and they were wonderful. The option is, many people think that undergo your treatment first for your breast cancer, remove the lump or remove the whole breast, right? And talk about reconstruction later. But for me, I wanted to do it all at one sitting because I would already be undergoing anesthesia. What I had to undergo was a free flap. Sometimes you use part of the back of your shoulder and you remove and you swing it over to the front, right? And you use that as reconstruction. But I couldn't because I don't have much muscle or fat around that area anyway. So then the free flap of the muscle and the blood vessels were removed from my lower abdomen and basically transferred and anastomosed. It was, you know, you join it back to the blood vessels of the muscles of the chest wall. The removal of the breast probably takes about 1.5 or 2 hours, but my entire surgery, because it involves microsurgery and having the free flap that I mentioned just now, the entire surgery took 13 hours. There were no complications from the reconstructive surgery itself. I believe the plastic surgical team actually were happy to discharge me at about day 10 post-operative. But I had a minor complication from the mastectomy that I underwent. So that's why I was admitted for a total of about 3 weeks. Even throughout the 10 days to the 3 weeks, I was already, you know, I was able to eat well and sleep well, right? Recovery was good. It's just that complication from the mastectomy. I'm still on the follow-up with both my oncologist and breast surgeon, because after I did immediate reconstruction, I then had to undergo chemotherapy, and I had to have 6 cycles of chemotherapy. It was challenging. So it's been 3.5 years since I completed treatment, and with the regular surveillance that I have, Alhamdulillah, I am at the moment disease-free. But I am more conscious about what I eat. So, you know, it's got to be freshly cooked food and preservative-free. Apart from lifestyle, I think it also makes one revisit about how you handle your life as a whole. It made me look at all angles, various angles. So spiritual, right? So work, spiritual, diet, physical activity. I'd like to say that sometimes you go through a very challenging period, but you must always be positive, because with difficulty there will be ease. When you go through hardship, there's always something good to come out of it. The impression is when you talk about plastic surgery, then you're talking about enhancing appearance externally, right? But in actual fact, like in my case, right, I chose to do that because it was a necessity for me. The plastic surgeons go way beyond just enhancing appearance on the external side. They do fantastic job. They involve in management of patients who have burns. They also do surgery, children who have the cleft lip and palate. So you can't say that's just merely enhancing, you're talking about functionality. So they are the team of doctors, it's the plastic surgeons. It's not just any general surgeon, it's the plastic surgeons. So they do a fantastic job. So I think we need to appreciate that they certainly do a lot more than just enhancing appearance. They do a lot. Yeah.